So Valerie, do you do monthly breast self-examinations?
I don't. Am I supposed to?
Actually, officially, you don't have to anymore.
Okay, good.
Even the American Cancer Society says that it's no longer recommended.
So even though I don't do self-breast exam, for some reason I always thought I had to do it. So what has changed?
Well, actually, studies have shown that in an average-risk woman who participates in the screening program, doing monthly breast self-examinations did not lead to more cancers being detected. It did not prolong life, but what it did do is that it led to more unnecessary tests, and that created anxiety in the patients.
So I'm still a little bit confused. What are women supposed to do then?
Well, the new thing now is to practice breast self-awareness. And basically what that means is that a woman should know how her breasts feel and look through daily activities, even though they don't need to do systematic breast self-examinations every month anymore.
Okay, that makes sense. So how do you practice breast self-awareness?
Okay, so breast self-awareness basically is a woman noticing changes in her breasts, such as lumps, bumps, skin dimpling, discharges, or deformity. And she does that through her daily activities, such as bathing, dressing up, sex. And whenever she notices a change, she should report it to her physician. But the difference here is that you don't need to do it on a systematic monthly basis, but you do need to still be aware of what your breasts look and feel like.
So know your breasts.
Exactly.
So then what do you tell your patients?
Well, I tell them exactly what you just said. Know your breasts. That's very important. So for my patients who don't want to do breast self-examination, I actually acknowledge that it's not proven to be beneficial anymore. So I tell them that that's okay, but they still need to be aware of changes in their breasts. Now, if one of my patients actually wants to do breast self-examination and advocate for herself, I actually tell her that it's okay to do it.
So then, for women who still want to do self-breast exam, can you actually show us how it's done?
Of course. Can you give me a minute?
Certainly.
So here's my little creation. I have a bra and I stole 2 implants from Valerie. Now, you have to remember that when you do breast self-examination, you have to do it without any clothing. So we're going to remove the bra and we're going to do the exam. First, you look. So you have to put your arms up and then you put your arms on your hip and you press slightly. And you look in the mirror to see if you have deformities, lumps, masses, or asymmetry, or any other change. Second, we feel. Now, when you start feeling the breast, you can do this both standing up and lying down. And when you lie down, the best way to actually do it is to put your arm behind your head. And you do it in both positions. The important thing is to actually feel all the areas of your breast. And you can use either the tip of your finger or the flat part of the fingers. And what I do is I do it this way. I press and roll a little bit in every single quadrant of the breast. And I make sure that I feel behind the nipple as well. Now, to be absolutely complete, make sure you also examine your armpit. And you repeat this exam in both sides of your body.
I'm relieved to know I'm not neglecting my health, but I do get my screening mammograms.
Yes, and that being said, you still need to be aware of your breasts.